Community health nursing. They're visible. According to WHO Expert Committee in 1974, according to WHO Expert Committee in 1974, community health refers to health status of members of community to the problems affecting their health and totality of healthcare provided to the community. Now, according to ANA in 1980, CHN is a synthesis of both public health and nursing practices applied to promoting and preserving health of people. We also can write this as CHN. It is the integral knowledge of nursing and public health service applied to promotion, preservation, maintenance of health and prevention of illness by direct services or referral services or education in collaboration with other members of health team by involving the community to achieve the goal of health for all. Their goal was health for all. Okay, goal and aims now. Next we have goal and aims of CHN. To promote and preserve health, to restore health. First goal is to promote and preserve health. To restore health when it is impaired, minimize suffering and distress, and promote quality living. These goals can be achieved by providing quality care and community health services by working with individual, families, and group. Self care helps to make individuals self dependent and preserving their own health, preventing diseases and health problems. Next is the priority practices. In community, we divided it into three prevention levels. First is primary, then we have secondary, then we have tertiary. In primary, it is a pre-pathogenic phase of disease or the health problem. It includes all those measures which promote general health and well-being. It is a pre-pathogenic phase. It protects the people from specific disease and health problems, for example, balanced diet, immunization, environmental sanitation, and control of pollution. Secondary is it includes all those measures will help in arresting the disease process. Arresting the disease process. Restore health and control further spread of disease. For example, early diagnosis and treatment, health education, and safe disposal. Then we have tertiary. It includes all those measures which help in minimizing suffering. Reducing or limiting the impairment or disabilities and promoting adjustment to disabilities. For example, medical rehabilitation, social and psychological rehabilitation. Medical rehabilitation. Okay. Then the next goal is the focus and practice level. To promote and preserve the health, to restore the health when impaired, to minimize the discomfort, and to promote quality skills. It helps in achieving these goals by providing comprehensive health and nursing care to the entire community. Okay, it promote and preserve the health, to restore the health when impaired, to minimize the discomfort, and to promote quality skills. Next, objective and principles. Okay. In order to assist the nurses in achieving the goals of community health nursing, the nurse and the agencies dealing with the sick people or client should have certain principles that mean certain basic ideas. CHN is an established health activity based on recognized needs and functioning within the total health program. The activity of nursing includes reorganization of nursing health needs and provides supervision and counseling for health promotion, health appraisal, rehabilitation, prevention, and control of disease, and provide care for the sick patient or client towards cure or a peaceful death in their homes. The Community Health Nursing Agency has clearly defined and purpose for its services. CHN services are available to the entire community, regardless of origin, culture, social economic resources, and also it should be available to people irrespective of their age, sex, and nationality. An active organized citizen group representative of community is an integral part of the community health program. Community CHA and agencies, government and non-government need to share the representation of to community group. CHN recognize the family and community as a unit of service. Health education and counseling for individual, family, and community are integral part of CHN. Healthcare should participate in planning related to goals for the attainment of health. CHN should be qualified and skillful. Periodic and continuous appraisal evaluation of the health situation of client are basic to the CHN. The community health nurse should function as an important member of health team. Qualified nurse to make supervision of community health, which help to develop proper policies to develop standard health and nursing care services. The CHN does not provide material relief to client but direct the client to appropriate community resources for necessary financial and social assistance. If people want to take something, ask them to go to primary health center or subset. Primary health center or subcenter. The CHN nurse should not accept any gift from the client. The CHN nurse should not belong to any one section or any political group. CH an agency should provide a continuing education program for nurses. The community health nursing services should develop proper guidelines in maintaining records and reports, follow strictly recording and reporting. There should be proper facilities and job conditions like proper salaries according to qualification, experience, and level of position. The community health nurse should maintain professional relationship with all the leaders in the community and maintain ethics at all times. Next है concept and importance of CHN. A community is a social group determined by geographical boundaries and common values and interests. Its members knows and interact with each other. It functions with a particular structure, exhibits and creates certain norms, values, and social institution. C community health divided into three parts. Community as a collection of people, as a place, then as a social system. Community as a social system is Maslow's theory. Individual needs like self actualization needs, self esteem needs. We have individual needs here. Like self actualization needs, self esteem need, love and belongingness, safety and security, basic physiological needs. Then the community needs. Community realization needs love and belongingness, community safety and security, right? Community life sustain need. Then community recognition name. Then have scope of CHN. It practice encompasses the goal and aims of the community health services, the priority practices or services, the focus of these priority practices and practice levels. Then have qualities and function of CHN. Community health nurse functions in a variety of roles. These skills may be related to communication, teaching, learning, interpersonal relationship, problem solving, critical thinking, and decision making. CHN plays a variety of roles as a care provider, promoter, teacher, advocate, organizer, manager, consultant, coordinator, evaluator, researcher, and referrer. Okay, so nurse provides the direct nursing care to the patient, example bed bath, hair wash. Then community health nurse provides indirect care to the patient by supervising, guiding, and teaching the family who is responsible to give the care to the patient. Then the advocate, community health nurse is an advocate for her clients and speaks to support on all health aspect. She can be advocate in two way by helping client to obtain what they are entitled to by health system and be trying to the health system to be responsive to the client needs. She is mediator and gives advices who will explain to the doctor regarding problems in taking the treatment. Then has steps of nursing process. It is a systematic process of knowing and exploring the defined community for assessing its health status and determining the possible factors affecting the health of the people in the community. Then the purposes. Community identification provide comprehensive knowledge about community health status and health problems. Community identification provides opportunity for establishing working relationship and gaining satisfaction of the community. Community identification will help in making community diagnosis, that is, it will highlight community health problem or health needs on the basis of analysis of all data collected. The problems could be with the reference to people, the environment, lifestyle, and resources. Community identification is instrumental to community health planning. Community identification promotes community participation. Then we have importance of this process. Systematic and continuous collection of data about the health status of the system. These data should accessible, communicated, and recorded. The health status data provides the basis for nursing diagnosis. Nursing diagnosis forms the basis for goal and nursing care. Plans for nursing care include priorities and nursing measures to achieve the goal derived from the nursing diagnosis. Nursing action provide for system participation in health promotion, maintenance, and restoration. Nursing action assists system to maximize their health potential. The system progress toward mutually determined goals set up by the system and the nurse. Nursing action involve ongoing reassessment, reordering of priorities, new goal setting, and revision of nursing care plan. Next is concept. Community is a target of service in C community health practice. The focus is on the health of community at large rather than the individual or family health. Community health nurse must consider community as the client. Understanding of the community is a prerequisite for providing effective services to the community as a client. Community health care without community study, its assessment and diagnosis, that is community identification, is like giving care to a patient without knowing his individuality. Investigation and diagnosis where is bound to be ineffective care. The concept of community and community health determinants form the basis for community identification for health assessment. Community identification is the beginning of the community health and nursing care process. It refers to assessment phase. This phase is fundamental to planning of community health action, which is followed by implementation plan. It includes four phases. Assessment, planning, Action, evaluation. Assessment means community identification, planning of data collection, methods and techniques, data collection, data analysis, community profile and diagnosis. Okay. In assessment, we have community identification. It is a systematic process of knowing, exploring defined community for assessing its health status and determining the possible factor affecting the possible factor affecting the health of people and community. Provide comprehensive knowledge about the community profile, its health status, health problems. Explain about her presence of in community agencies, policies and objectives, services handed to the people. Highlight the health problems, health needs basis on data collection like children under 5 years, nursing mothers, health attitude. Instrumental to community problem and health action plans according to priorities, goals and objectives. Promote community participation, mix with people, leaders, and get informed about each other's intentions and expectations, strengths and weakness, and motivate to full participation health programs. Planning of data collection categories of information. Geographical area, boundary of a community, physical setup, pattern of settlement, arrangements of dwellings and other buildings, street connecting sources, important landmarks and institution, availability of needs, old traditional or new multi-storied. Next we have planning of data collection categories of information. Okay, like experienced people for urban area towns, it is exposed to risk of first life. Traveling long distances, heavy traffic, competition in rural areas which are dependent on agriculture. Then we have natural resources. Natural resources are forests, jungles, water, and minerals. Sources of economy in rural area. Health problems varies according to place. In a particular place from time to time, important landmarks, changing trends, climate. Panchayat Ghar, school, primary health center, post office, police station, bank, religious center. These are helpful to searching and locating the houses. Environmental sanitation, control of housing, food, water, refuges of excreta, waste, etc. Air, soil, insects, and rodents. Population characteristics, size, density, composition, city composition, vital events, high risk group, social structure, source of information, geographical aspect of community maps, local administrative body like municipal panchayat, Raj organization, enrollment protective agencies, population aspects, periodically updates, registration departments of birth and death, social system aspects, local political and administrative bodies, method to approach, forum method, and this is the third we have method to approach. Okay, it is the forum method. Community identification is done by service, formal and informal meetings with people, panchayat members, school teacher and mahila mandals, professionals, etc. Then the observation method. Observe checklist questioning method. Open and close ended questions can be prepared to collect the information. Record review method. Demographic information and vital events. Discussion on method like health problems, difficulties encountered. And the other are the physical examination method and clinical exam investigations, etc. Then the fourth we have data collection. Data collection means community to be studied, name, address, level of community, and determine the objectives for community identification, purpose of identification, specific information, identify the population and sampling unit under study, Decide on sample size and sampling method. Develop the instrumental desired example, interview schedule, observation checklist. Organize and conduct survey. Community profile and diagnosis. Community identification process helps determine community profile and help in drawing conclusions or make diagnosis as its health problems and health needs from interpretation of data collected. Community diagnosis is written statement of community health needs, health problems which are assessed from data collected. Diagnosis is with reference to health status of people, demographic characteristics, social structure, lifestyle, health knowledge, attitudes and practices, environment and resources available, etc. Diagnosis can focus wide range of factors influencing health and wellness status of community. Example: early marriage, poor education, incomplete immunization, malnutrition, and unsafe water supply. Next, we have planning. It is very important to determine the course of actions to be implemented to meet community health needs and resolve community health problems. There are four steps included: analysis, health needs, health problem, establishing priorities, setting goals and objectives, formulating community health action plan to achieve the objectives. Like analysis of health problems to clarify the nature and extent of problems and factors associated with problems and the resultant consequences. Then establishing priorities. Priorities wise health problems because limited resources available and many problems deal with which is not feasible. List of List of health problems are health threats, factors, health deficits, stress point, severity of the consequences. Health deficits, stress point, severity of the consequences of the problems, salience, perception and evaluation of the problem. Okay, then the prevention potential. Prevention potential problem may be prevented and controlled. Then the setting goal and objectives. Setting goal and objectives are set up priorities. The goal and objective should be clear. It is further divided into two parts: general and specific. Okay. Prevent and control anemia, immunization against tetanus, identified high risk mothers and provide referral service. Register all the mother by 12 to 16 weeks, educate and counsel based on needs, control the death rate. Specific goals and objectives: assess the growth of all the children under 5, identify children risk, identify malnourished children, carry out prescribed treatment and comprehensive care all children, arrange the possibility of food subsidy. Okay. Next, we have formulating community health implementation action plan. Formulating community health action plan to identification of appropriate community health and nursing intervention and implemented to achieve the established goal and objectives. The criteria which can help choose alternative actions are the resources available, the nature of problem, agency, policy, practicability and efficiency, competencies of health personnel, community is interest and feasibility. Then implementation of community health. Implementation refers to putting the plan into action to achieve the set goals and objectives of community health. She functions independently as major emphasis is on primary prevention and control of health problems, according to Ruth Furman Freeman. There are three types of nursing intervention. There are three types of nursing intervention. First is supplemental, second is facilitative, third is developmental. Supplemental, that is doing things for the families, groups, and community at large which they are not able to do. Example, nursing care of the sick at home or center. Facilitative means removing barriers, obstacles. She helps them to mobilize and develop their resources. Nurses know community resources, health, and their function. Developmental, helping families, groups, and people at large to develop and improve their capacities. She educates members to recognize their health problem, health needs, find solution, and develop their resources and abilities to implement action. Then we have evaluation of community health. Evaluation is a process of ascertaining the effectiveness of something or some organized activity or program in relation to some set standards and criteria. Evaluation is done at each steps of the process to get feedback so as to make accurate decision as far possible. It begins with assessment phase when decisions are made while preparing community identification guidelines for collection of data. Evaluation is then done in the planning phase when problems are analyzed, priorities are established, goals and specific objectives are set. Alternative actions are planned to achieve the goals and objectives. Evaluation is finally done with action are implemented and results are observed and recorded. The progress of results, difficulties and constraints encountered are compiled and computed at the end of the week, month and year. Evaluation is both individual member activity and team activity. It is done by individual team member of his or share of contribution and responsibility. We have Nanda here. It means North American Nursing Diagnosis Association. Defines It defines nursing diagnosis as a clinical judgment about individuals or community responses to actual or potential health problem or life processes. Altered body temperature, injury, altered bowel function related to consumption of blood water, altered behavior pattern related to substance abuse, addiction to drug, alcohol, altered comfort related to pain, altered fluid and electrolyte balance related to diarrhea, bleeding, altered nutrition status related to pregnancy, lactation, anemia related to pregnancy, lactation, health seeking behavior related to child care, budget children, knowledge deficit related to immunization, impaired adjustment. Then we have CHN practice. Community health nursing practices directly to promoting and preserving the health of population. Their practice is general and comprehensive. In recent years, we have acquired a new philosophy of health. Our health is fundamental human right. The community health nurses practices in a variety of settings and in different ways from the traditional nursing practices to acute care facilities. Community nursing is collaborative, interrelated, and occasionally overlapping with other health disciplines that its role may become blurred depending upon the situation. CHN is a synthesis of public health science and nursing science. The knowledge on which practice is based incorporates theory from both public health sciences and nursing science. The community health nurse control of communicable diseases, environmental sanitation, vital health statistics, laboratory services, maternal and child health, and health education. And we have CHN practice goal and objective. Contribute to improve the community health nursing practices and service to community. Continuing education and enhancing knowledge in the field of CH must be an integral part of professional practice. New staff must be given adequate training and orientation to various programs. Research must be conducted in relation to community health needs, problems, and solution to the problems to increase the capabilities of the individual, family, and group or community to cope with health and illness problems. Community must have a positive and accepted attitude towards the services provided. They need appropriate guidance to develop general problem solving ability to enable them to deal with the health problems for self reliance. To control physical and social environment condition that threatens health of people, the community health nursing educate the people about healthy and safe environment from health threats like accidents, communicable diseases, inadequate and unsafe water supply. And environment should be conducive to social behavior, example, good affection between parents and children. Support and supplement the efforts of health workers or agencies in controlling communicable disease and in restoration and preservation of health. Nursing support should be given to other health team members for the care of families, group, or community by providing required information, preventable diseases, and presence of health threats, and the response to the offered health service. Philosophy. In recent years, we have acquired a new philosophy of health, which may be stated as health is the essence of a productive life and not a result of ever increasing expenditures on the medical era. Health is fundamental human right. Health is intersectoral. Health is an integrated part of the development. Health involves individual, state, and national responsibility. Health and its maintenance is a major social investment. Health is a worldwide social goal. The right of an individual for basic necessities, the importance of freedom to express one's individuality, the right of the individual to help in times of need and crisis. And we have principles. An effective member of the health team, community health nurse, is accountable to the health authority, maintains the professional relationship and ethics at the workplace. Health teaching is an integrated part of community health nursing. Family and community are the units of CHN. Provide the health services to all, irrespective of age, sex, nationality, social and economic conditions. Evaluation, evaluation planning. Records and reports are essential community health nursing. Community diagnosis.